We're going to hear more from Emily coming up a little bit more in our next half hour, but right now we have Dr. Shelton McMullan, a gastroenterologist with MedStar Health, here with us as we continue to take your calls and answer your questions about colorectal cancer. Doctor, tell me, is there anything that you can do to prevent colorectal cancer?
So that's a good question, Kelly. The short answer is no. What I'm going to talk to you about now is the importance of screening. So I would say the way to prevent it is to get screened. There's some thought that perhaps maybe regular physical activity, eating a lot of fruits and vegetables potentially could help prevent it, but there's nothing really to prevent it. Mm-hmm. Screening is so important because potentially we can find what are called polyps, which are abnormal growths in the colon. Some of these polyps can be precancerous, meaning with time they can ultimately turn into cancer. The natural progression of colon cancer is that you develop one of these small precancerous lesions or polyps, and then with time you develop sort of more precancerous changes, and then ultimately that turns into colon cancer. These polyps typically cause no symptoms though, and that's the interesting thing. So you would have no idea that you have these polyps unless you get screened. And so the real importance of getting screened is that if you happen to have these precancerous polyps, I see them and then I take them out. And by taking them out, that then takes away the risk for them ultimately turning into colon cancer.
So now the recommended age to start screening used to be at 50, but now it's down to 45. Tell us about that. Why the change?
Correct. For a long time it has been age 50. I will say for a long time, for African Americans, it has been recommended to start at 45. In 2018, the American Cancer Society recommended that everyone get screened at 45. As of October of this last year, something called the U.S. Preventative Task Services Force recommended age 45. So really for everyone now, it's 45. The real reason behind that is that the prevalence of finding these precancerous polyps, they're found just as often as at age 45 as at 50. Okay. And so it makes a big difference. That 5 years is really important.
And this is something that you're more prone to get, as you get older.
Very true. Colon cancer in general is pretty rare, less than age 40, but the increased risk once you get to 40
goes up.
Progressively rises. So 45 is what I want everyone out there to realize.
I was going to say, like everything else, it goes up as you get older, it feels like these days.
Seems that way.
Dr. McMullan, thank you very much for joining us. Now, if we are taking your house calls until 6:30 tonight, if you have questions about colorectal health, just want to see how healthy you are, MedStar is offering out free health kits to Maryland residents. For details on how to register, just head to our website at WMER2news.com. But also, if you got questions, we got a studio full of experts standing by to take your calls. That number is 410-671-0702.